Hello. This is Dolores, Dr. Barbo from Neighborhood Connections, and Mary Claire, who's going to help me with this presentation today. And we're here after what seems like a long hiatus. I'm sure everybody got tired of hearing about cholesterol and memory loss, and but we're back. And back with some questions, with some new programs and some ideas. Today we're going to talk about things that are probably good now that our late spring here in Vermont going into summer has been a horrible allergy season, and people are snorting and coughing, and that I thought it might be good to stop and talk about our lungs.
That's a good idea.
Our lungs are our whole respiratory system, no? And so I'm wondering, what is our respiratory system? What's included in our respiratory system?
All I know is about the lungs.
But how do you get to the lungs?
Your throat.
Good. Okay. So it starts actually in the back of your nose and your mouth, and that the nose is actually part of your upper respiratory. We talk about upper respiratory infections, which I'm not going to deal with today so much, and sore throats and problems in our mouth. But it all empties into our throat, you know, and then our throat goes down our trachea and into bronchioles and lungs. Okay, so I brought a set of lungs today. This is what we generally imagine our lungs to look like. No, here's the trachea. This is a little bit longer, and it divides into two big long branches that are our bronchioles, and here are our lungs. So that when we breathe, we blow up these two big plastic bags of air.
Oh, I love your display.
Yeah, and then when we exhale, you could, okay, the air comes out. Wrong.
No?
That is not what our lungs look like.
Oh.
Our lungs actually picture a combination of a maple tree and an apple tree. An apple tree because it's got a zillion branches, and a maple tree because it's a little bit elongated in the wintertime. Okay? Take all the leaves off. You can leave even the stems from the leaves, I don't care. But take all the leaves off. Turn that upside down.
Oh, okay.
And what you have is a whole bunch of, you've got a main, upside down, that's the main trunk of the tree. You've got some main branches here. Let's do one more here. Okay, here you've got a couple branches from this main trunk. And at the end of this you've got a zillion other branches, and they actually fill up your whole cavities here. You've got three main branches here, and then a zillion branches, and two main branches here, and a zillion branches. And these are your bronchioles. Okay.
You have two branches on one side, three on another?
Main ones, yes.
Yeah, okay.
Right? And then at the end of every tiny little branch in your head, tie a balloon. Your lungs are actually 1,000,000 little balloons. That literally 1,000,000, 2,000,000 little balloons that every time you take a deep breath, you're blowing up a balloon. Every time you exhale, the balloons are deflating, let's say, all right? That's your lungs. So your bronchioles are these empty tubes, that's true, but after they go into your lung area, they divide into two or three main branches and then a zillion branches. Those are hollow tubes, like these would be, all right? Those hollow tubes have hair in them, like the hair on your arm. They have hair, and the hair is constantly moving upwards. All right, constant, like swaying in the wind, like fields of wheat that you imagine in poetry.
Does the air make them sway, or they just sway by themselves?
Well, the air does, because we're going in and out. So we breathe in, and it flattens them out, and they bring themselves up again. The this whole thing here, this whole, let's say on the left side of your chest, there's two main tubes. That branch here and that bunch of balloons and little branches are covered by saran wrap called your pleura. Oh. It's covered by a membrane. And that membrane, you're not aware of it, you don't see it. It's exactly like the saran wrap that covers meat in the IGA. When you're buying the meat, you're not looking at the saran wrap.
Right.
Okay, so it's just there. That's covered, just kind of holds it together. So you've got two main, what we call lobes on your left side, one coming from each of the main branches, and you've got three here on the other side. You've got an upper lobe, a middle lobe, and a lower lobe of your lungs. And so every time you breathe, you're actually blowing up balloons. Every time you exhale, you're okay. So, have you heard?
Can I ask where the lungs are located? I mean, there's the heart. They're behind the heart, or?
No, they're around the heart.
Oh,
Your
okay.
heart's in the middle, but a little bit more to your left side.
Right.
And your lungs, the branches come down and just go right around that.
Oh, okay.
All right. So there's not so much in the front, a little bit more in the back of the bottom lobe of your left side. And your right side is a little bit sculptured by your heart, but your heart's sort of in the middle.
Okay.
And a little bit to the left side. So when we listen to the heart, for instance, we listen on the left side because that's what we're hearing.
Okay.
Okay.
All right.
We should probably do a program on the heart, shouldn't we, sometime?
Yeah.
Okay. So let's talk about things that can happen to this whole
Okay.
apparatus here. One of the things is people say they can't breathe. What would make somebody not breathe?
Infection, maybe?
Okay, but like, I really can't breathe.
I don't know. That sounds really bad.
What do you see pictures of in and big signs of what to do if you're in a restaurant? You're in a restaurant and somebody can't breathe.
I don't know.
You're just going to watch them? If somebody in the next table over suddenly couldn't breathe, I don't mean they stopped breathing, they couldn't breathe.
I would think that maybe there's an obstruction.
Good. They're
Okay.
choking.
Yes. All
Okay.
right, good.
And that's usually something happening in your throat.
Okay.
Okay? So either they're choking on something from the outside, in which case there's pictures all over the restaurant that tell you to do it.
Yes, right, the Heimlich, right?
Right. Or they ate something that's causing a sudden swelling of their throat.
Oh, they're having a reaction.
Right. You know, you hear about penicillin doing this, but you can have an allergic reaction to
Strawberries, I know.
strawberries can do that, shrimp can do
Yeah,
that, okay? So one of the things is choking, and if there's a sudden can't breathe, there's something that's going on with that needs an emergency, okay?
Okay.
That's one symptom. Another symptom, another thing we can feel is pain. Of all this apparatus that I just discovered or described, pain has to have nerve endings. And I have to tell you this, there is no nerve endings in your lungs.
So your lungs never hurt.
Your lungs never hurt. This is why, unhappily, if we have something really bad like tuberculosis, or we have a tumor growing in our lungs, we don't ever know it because it doesn't ever hurt. There's no nerve endings in your bronchioles or in these trees of balloons, okay? It's only tissue that does its own job. But that pleura, do you remember what the pleura is?
The lining.
Right, the saran wrap lining. That pleura is absolutely full of nerve endings.
Oh, okay.
So if the pleura, for any reason, is being pushed against, if there's swelling in the lungs, and we'll talk about what could cause that. If there's something that's pushing against the pleura from the inside, or the pleura is also right around your ribs are covering that and protecting all that. If something happens to your ribs, like what could happen to your ribs.
Like you break one.
Right. If you break it and it moves and touches the pleura
Or
and pushes
punctures it.
against it or punctures the pleura, then you've got a lot of pain. So there can be that sudden pain. And you know what people say when they cough a lot, they're hurting?
Yeah. Their ribs hurt, they say
Their ribs hurt.
sometimes. Yeah.
And it could be the muscles actually between the ribs, but it also could be what we call pleuritis. It could be an inflammation or infection of that pleura. Anything that's going to hurt in your lung area, if it's not your ribs or your muscles, it's the pleura that somehow is inflamed.
Never the lungs.
Okay. One more part of anatomy, that those hairs on the tubes have a function. They move things in and out. They don't move things in, I hope. When things are going in, they flatten out, but when they're coming out, so that if you get things in your lungs or down your bronchus that they shouldn't be, their purpose is to push it back out again.
They clean it.
They clean it, okay? So those cilia are there as cleaners. Okay, another symptom is cough. What do you think causes cough?
Well, it could be tumor could cause a cough, right?
A tumor could cause cough. Where does cough, when you hear somebody cough, where's the cough coming from?
Their throat.
Their throat, okay? Their throat is a cough because we have, oh, this isn't good, I shouldn't have done this, but we have the going down our throat. Can you pull that other one off?
I will try. You did too good a job.
Well, okay, just so I can get the bag off.
Okay.
All right. Going down our throat, forget the mess of this, I'm really sorry. We have two tubes. We have an open throat back here, and then suddenly there's two tubes. There's a tube in the front that's going down to the lungs. That's our trachea. Okay, that's the main trunk of the tree here.
Okay.
Right behind that, can you imagine what this other tube might be?
Is that the esophagus?
Right, it's the tube going down to our stomach.
Oh, okay.
So we either put air in one, or we put food in the other. Food or liquid or whatever, no? And we don't want both of them open at the same time, because if they were both open at the same time, the food that we eat would go into our trachea and down into our lungs.
That would be bad.
So it has on top of it a valve. We have a valve on our trachea that looks like two fingers that opens and closes. Do you remember reading anything about? Okay, those are your vocal cords.
Oh, yeah, sure.
Okay, the vocal cords are closed when I'm not breathing and they're open when I'm breathing.
Okay.
When I'm breathing, it sort of opens it up and pushes it against the esophagus so that the air isn't going down there so much, okay? So it only opens and closes as I'm breathing. A cough is caused by something that's irritating those vocal cords, period. Okay?
Not the esophagus necessarily or anything.
No.
The vocal cord.
The vocal cords have to be irritated. And that can only happen with one of four mechanisms from the inside, okay? Either like a steady stream when it was raining outside and everything was dripping off the roof, okay? A steady stream of something that goes down and hits these closed vocal cords all the time, like sinus drainage, or you have a cold and you got a whole lot of mucus that's just in the back of your throat. It drips down and irritates this and causes it, okay? The other thing that can cause that, like you said, is a tumor itself of the cords that won't let it close totally and it's irritated. The third thing that can cause that is if something is going on in the lung issue or the bronchial issue and it's producing a lot of mucus and pushing up and kind of splashing out over every time it opens, splashing out onto those cords, that's going to cause it to try to clean it out. It coughs. The other thing is, did you know what GERD is? Do you ever hear of anything called GERD?
I don't think so.
When people have heartburn, they can have GERD. Do you know it?
Now, how do you spell that?
Well, it's GERD is what you're going to see.
Okay.
It's acid from your stomach can shoot up and come all the way up into your throat and overflow onto those vocal cords.
Oh, okay.
All right, so that irritates your vocal cords and makes you cough. Those are the only things that will cause a cough. It doesn't mean you aren't going to have irritation down here, but the cough it's something that's forcing air through vocal cords that aren't exactly happy.
And something's irritating the vocal cords.
So it's either dripping down from above or coming from below. If it's dripping down from above, it's obviously from a cold or something up here. If it's coming from below, it's coming either from your lungs or your stomach acid, or the vocal cords themselves could be problematic. And that's what will cause a cough. You can have problems from the outside, like medications that aren't irritating it so much. For some reason, there's some medications, like some blood pressure medications, for instance, that might cause a cough, called ACE inhibitors or whatever. If you're walking along outside in the field in the springtime, okay, and there's so much pollen in the air, not even from allergy, or you're walking on a dusty road in a windstorm. Anything like dust or pollen or an irritant from the outside can get on those cords and cause a cough too, okay? So you've got either one of four things in the inside, but if you just think of your body, you're either dripping down from above or liquid coming from below, from your lungs or your stomach, or it's something from external to your cords. Okay, either medications that you're taking or an irritant. Okay, that's sort of the anatomy of our lungs, okay? Let's talk about some of the things that can happen with our lungs. One of them is plain old bronchitis. What do you think bronchitis is?
Well, the bronchioles, right? That's the little aren't the little tubes inside?
Right.
Yeah, they get infected or inflamed or something.
Or something.
Yeah.
Right.
Okay.
Itis means inflammation. Tonsil, tonsillitis, appendix, appendicitis.
Oh yeah. Okay.
Okay, bronchioles, bronchitis.
Okay.
Okay. So anything that, as soon as these tubes separate into both sides, those are your bronchioles.
Okay.
Okay. As they get smaller and smaller branches, then they're called medium-sized bronchioles. Then they're called bronchiolos, and they have all these fancy names for these little tiny things. But it's any of the tubes of your respiratory tract that are bronchioles. If they get inflamed, it's called bronchitis. And I'm not talking about your lungs. This is just the tubes.
Okay.
All right. And the tubes can be, you can get bronchitis from a whole lot of things, no?
Is it a germ?
You can sometimes get a germ, although it tends not to be. It tends to be more irritation, okay? So you can get, if your immune system's down, in general, you probably could get a germ just that only goes into your bronchial tubes. But and very often then, most often, it'll be a virus, not a bacteria.
Oh, okay.
So a lowered immune system can get a virus that'll just infect your bronchial tubes. One of the biggest things that will do this is smoking. Why?
Well, it's an irritant.
It's an irritant. And can you think of what would make it an irritant?
Well, it's got bad chemicals.
Okay, so the chemicals get in, we're inhaling it, and they kind of coat your bronchioles. The other thing they do is burn those, it's hot air, so it burns those hairs going down into your lung, okay?
Does it burn them away?
It burns them slowly away,
okay.
which is really important.
Yeah, because they can't clean then.
They can't clean. Another thing that can happen is because of work that people have, they can be anything from coal miners to farm workers to like people working with hay a lot in their barns, okay? That as we breathe in things, just like the smoking would, it coats the inside of those bronchioles and doesn't let the cilia, those hairs, work just right. So that can cause a problem. One other thing that we talked about was this. Remember we said that the stomach acid could come up one tube and overflow into this? Well, it can overflow into this, and if it actually overflows enough that we start coughing and choking, some of that acid can go down your bronchioles and also burn away your cilia, your hairs, and irritate them and inflame them and cause like a burn in those tubes. So bronchitis can be caused by a lot of things. Usually it's not a germ, and usually, and this is really important, if you're going to treat this, you don't need antibiotics.
Can you tell what it is on an X-ray?
No, you don't see anything on.
Okay.
But you can do it by just listening. When I listen to somebody with bronchitis, normally when I listen to somebody that's totally normal, if there are normal people in the world, if I listen to somebody with normal respiratory tract, I'm going to hear all I'm going to hear is a pronounced.
Do you mean with your stethoscope?
With my stethoscope.
Okay.
If I'm listening to somebody that has tubes that used to be big, and now they're skinnier because they're all swollen inside. Can you? It's what I'm hearing is almost like blowing over a Coke bottle. I'm hearing what we're calling bronchi, which is kind of this deeper. I can't do it, but
okay, yeah.
Okay. As the air is trying to get in and out through these smaller tubes, it's almost a whistle, like you would.
Yeah.
People still blow over Coke bottles?
Sure.
They have cans now. I don't know if they blow over Coke bottles, but it's that sound that you hear.
Yeah.
That's what I would mostly hear. Sometimes when you're walking by somebody with a really bad bronchial inflammation, you can hear the wheezing yourself, okay? With little kids, moms can hear wheezing, okay? And we will get back to wheezing later because we often associate that with asthma for a different, in a different mechanism, but it's that same kind of wheezing, okay? So you aren't going to get it from X-ray, you are going to get it from a clinical exam, okay? So what do you do with this? If you can't use antibiotics, do you have any sense of what people do when they get bronchitis?
Are there any medicines that can open that up?
There are medicines, but if you think of the reasons, first of all, why you can have it. For instance, if your reasoning was something coming from down here that really got into here, into your lungs, one of the things you want to do is get that out. No, you want to get all this gunk out. In the source of inflammation or in the response to inflammation, very often the tissue around the inside is going to form some thick mucus. And what you want to do is get this mucus out. And you know how hard it is when your mucus gets really, really thick?
Yes.
Yeah. One of the prime things to do with bronchitis is to make sure that you're getting enough humidity. Make sure you're drinking lots of liquid so that you thin that out, but get in a hot shower.
My mother used to put us over a humidifier with a towel.
Yeah, if you can get into it, if you have a humidifier at the house, if not, put a pot of something, water on the stove.
Hot shower's a good idea.
Hot showers are good. You really can't stay in the shower for 20 minutes or so. So what I tell people to do is
I could stay in the shower.
You can stay in the shower for 20 minutes. Oh, we don't have that much hot water.
All right.
So what I tell people to do if they have a tub is to make sure everybody in the house has peed first so that nobody bugs you. Find a good magazine or a good book. Go in the bathroom, put water in the bathtub, close the door, put water in the bathtub from the shower head so the room is absolutely full of steam. And sit in the bathtub and don't let anybody bug you, and read your novel, read your magazine. If the water gets a little cool, but you're okay in that humid atmosphere, put in some more hot water down below, not from above, unless you want to take a shower sitting in the tub. And stay in that humidity as much as you can. Okay, so any kind of humidity is going to help. Increasing the amount of liquid you're drinking. If your problem with the inflammation is coming from acid reflux, any suggestions on what to do with that?
Well, there are medications for that.
There are medications, but before the medications?
No, I don't know.
You have any idea at all, literally? of what
No,
to
I
do to
don't.
stop acid reflux?
No.
Okay, one of the things you don't want to do, if you're going to get acid reflux, especially when you're lying down in bed, because
Oh,
you're like this and it can just drain
That's
up
when it
here.
happens to me.
Does it?
Yeah.
Okay, then we'll talk about
Okay.
acid reflux sometime. One of the things you want to do is not lie down right after eating, so
Oh,
there's nothing
okay.
in your stomach.
All right.
If you can raise the foot of the head of the bed by putting some blocks of wood or a couple of bricks under the feet of the head of your bed, so that your bed
Oh.
is a little bit like this.
Always, you mean? Okay.
So that all the time, no matter what you're doing, your
At an
acid is
angle.
going to stay down by gravity.
all right.
All right.
Pillows? A lot of pillows, maybe?
Well, you can, but the problem with the pillows is by morning, this is what's happening.
Oh, yeah, right,
The pillows tend to go up and you've slid down.
okay.
So that if your bed is not attached to the wall, if you can raise the feet of the head of your bed, you're doing a whole lot better.
All right.
And yes, you can take medications for acid reflux. At least whatever comes up might not be acidy, it won't burn your lungs, but it still might be liquid and get in your lungs. So it would be better if you didn't lie down right after eating, and if you were aware of what's causing the acid reflux as far as which foods are worse for you, and raise the head of your bed. Okay, do things like that would help.
That's a good idea.
If you're working in a barn,
You could wear a mask.
thank you. And I know everybody hates wearing
I
masks.
know,
They feel
yeah.
trapped. But the reality is what it does to your lungs can be as bad as smoking, except that it's not hot air that's coming in.
It's particles, isn't
It's
it?
particles, and the particles get down and they have to, Celia have to work very hard to get them up, okay? So before you even look at medications, you're looking at not bugging anybody for antibiotics and stuff, all right? You're looking at getting humidity, at making sure it's not doing acid reflux, and doing cough medications, okay? Not antibiotics, cough medications. And reminding yourself that you got to check and make sure you're not just allergic to something, or you're not just being irritated by something, okay? There's two kinds of cough medications that you can buy: expectorants and suppressants. Expectorant's job, and there's basically on the basis of glyphenicin, is to like Mucinex, for instance, is to
Right.
liquefy all of that thick gunk and make it come out a lot easier.
Okay.
Okay? And expectorants are usually fine. Suppressants are things that stop the cough.
Like paralyzes it or something.
Yeah, they stop the irritation that you have, okay? And because the cough is coming from irritation that's pushing up against, and the mucus is getting here. Suppressants are something you should not use unless you absolutely can't sleep at night, okay? You should not use, and never with asthma or with serious lung disease, never when it's because of allergies that you need to get rid of this gunk with, and not with cardiac or blood pressure illnesses or glaucoma, things that already are dependent on keeping your pressure low. Because many of these suppressants have medications that, or chemicals in them, that are going to cause your blood pressure to be higher.
So when should you use a suppressant?
Absolutely, hardly ever, except when you absolutely can't breathe, or when you have a dry, hacking cough, and you don't have one of those illnesses. You don't have asthma, you don't have cardiac, you don't have hypertension, you don't have glaucoma. Then it's okay if your cough is just this dry, hacking irritant of your vocal cords, and you just want to stop your cough.
Okay.
Okay? There's natural medications that we could use for this, and I think you probably know some of them. Do you know what your mom might have used, or anybody might have used?
Well, Mother used to always rub Vicks Vapor Rub on us.
Right, menthol will actually calm that down. Honey. And people do honey and water and lemon, honey and tea and lemon. But you can also use mint, and putting mint in water that you're going to be breathing in is really good. Thyme, like thyme, rosemary
The
and thyme.
herb,
Yeah. And bromelain that you find in pineapple is an anti-inflammatory and can help that, all right? So all of those things you can help with bronchitis. We're going to stop here, I think, because we've reached our end of this broadcast. I don't know if this was a help to you at all to understand a
was,
little bit.
yeah.
We probably should come back and talk a little bit about pneumonias and other
Yeah,
things. So let's do a part 2 with some pneumonia and COPD and
That's a good
emphysema.
idea.
And,
Yeah, for sure.
Okay, thanks so
Good
much,
idea.
Mary Claire.
No, that was interesting.
All right, we'll see you next time.